You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about liposuction. On the show today, we have America's favorite dermatologist, Dr. Tess Mauricio, and we're going to talk about this new technology, LipoLite, a laser that actually dissolves or melts fat. If you have unwanted fat on your body that is not responding to diet and exercise, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction, a new technique that literally melts fat. With us, we have board-certified dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome.
Hi, Randy.
To the program. Always a pleasure to have you on.
Great to be back again and discussing LipoLite, which really has revolutionized the whole liposuction industry.
Has it really changed that much? It's just what, better results, low downtime?
It's all of the above. You know, it's as a surgeon, a cosmetic surgeon, it basically answers all of the things that I would want for my patients, which is, you know, the ability to sculpt away, really sculpting, and as an artist, that's very important. Sculpt away.
You consider yourself an artist?
Absolutely.
Okay.
I think, you know, there's part that's science, and this is what we're going to talk about with LipoLite, which is very exciting.
Okay.
And then part definitely, you know, the artistic ability, and as an artist, I really love the fact that I now have LipoLite as a tool to really give my patients the results that they want with really almost no downtime.
Now, is liposuction the number one procedure, number one cosmetic procedure still?
There's over 500,000 liposuction procedures performed every year, and in 2007, liposuction is the number one surgical cosmetic procedure. Everybody wants lipo, and you know, I sure have some areas even on my body.
I asked you. You said you're going to get it.
Absolutely. I mean, and you know, I've been waiting for a while because, as a surgeon, like I said, and because I know all the possible pitfalls of traditional liposuction, I have sort of waited and kind of lived with unwanted areas of fat on my body. But now that we have LipoLite, I'm even thinking, you know, I'm maybe doing my thighs.
Let's start with what is it? I mean, what is LipoLite?
LipoLite is an FDA-approved laser lipolysis system. So basically, as we have progressed in laser technology, now we're using it basically to rejuvenate your skin, rejuvenate the body. Now we're using lasers to go and melt away unwanted fat.
So this is used in combination with traditional liposuction?
Yes, we use it basically, how we do it is we pick, you know, whatever area you don't want. Say, for example, men's love handles.
Okay.
So that's the area we're going to work on. We use what we call tumescent anesthesia, which is the beauty of this procedure, LipoLite, is that it can be done all under local anesthesia. So
the patient is awake?
Patient can be completely
awake. Can they
awake.
talk to you?
They can talk to you. They can
really?
Make jokes, you know.
Right.
So it could be a very interactive process. And the nice thing about it is, I think, one of the biggest fears patients have about going in for liposuction procedure is going under general anesthesia. Yeah. And so now, you know, because we are able to do this, it's not very invasive. I go in, I numb up the area with local anesthetic, and then I make tiny little incision or access points that don't even need any sutures. I don't have to, you know, to suture them closed. Those spots really go away without really any
So
big
is it a
scarring.
laser? I mean, it heats the fat and then melts it?
It's like a pointer, a very thin pointer.
Okay.
There's a fiber optic, you know, end, and then there's a laser tip in the end. And I basically just insert that very, very gently through these tiny little holes, and then I keep it there, and it's heating fat. So it's heating fat.
So in the love handle area, okay, so you're heating that area. The fat is it being destroyed? Is it?
It's
I mean,
being
what are you doing
destroyed.
to it?
It's being melted. We're liquefying fat.
So you're liquefying it.
Right.
Then you go in with the traditional liposuction.
Right. We go in with our
cannula.
tiny cannulas connected to suction, and we take it away. And
it sounds so easy. I mean, is it that easy?
It is easy. I mean, that's the beauty of LipoLite. It's that nowadays, it's, you know, we're allowing patients who before were scared to go in because they're worried about the downtime, They're worried about having to go under general anesthesia. And also they're worried about lumpy bumpies, how it looks afterwards.
We've seen those celebrity photos.
Absolutely. Whenever I look at an ice sculpture, you know how all the edges are smooth, and it's just so aesthetically pleasing. And you know, how to achieve that? We're basically, instead of chipping it away, chipping at the ice, and now you have bumps and lumps,
melting it down.
You're melting the edges down. And so that's what LipoLite does. It allows us to melt. It also allows us to really come up pretty close on the surface of the skin. So instead of,
so you know, going in
with, well, you can go aggressive, but also doing it in a very, non-traumatic way compared to how we used to do traditional lipo. So instead of lipo where we're going in with our cannula and then you're creating tracks, you're actually...
So traditional lipo...
You go in with your cannula, you go in there, and then you basically take out, you're creating all tracks, and then sometimes you miss pockets of fat.
Okay.
Whereas with this, you go in with our laser tip, and then just the surrounding area gets melted pretty uniformly.
So it's always in combination then with traditional
yes,
lipo?
Absolutely.
Tumescent lipo we're talking
the
about.
The beauty of this and the advantage of LipoLite over other laser lipolysis systems, which also exist, is that this allows the surgeon the control. And that's really the reason.
What do you mean control?
Control to sculpt, control to actually know your endpoint. Because in the past, there are older laser lipo units that you go in with a laser, sure it melts fat, but because you're not actually removing the fat that you've melted, you don't know your endpoint.
Now when we said we were going to do a story on this and I called you, you said, okay, that's fine, but I want to make sure that people know Syneron is the company. LipoLite. Expand on that a little bit.
I'm so excited about this technology, Randy, because as a surgeon, and I've done traditional liposuction for a while now, and obviously there are things, I mean, liposuction we know works.
All right, okay.
You can remove the fat, exactly. You can remove the fat. However, there are problems with it in that, there can be a long downtime for patients. Many times, there's so much trauma during the procedure that you almost have to really knock your patients. You put them under anesthesia.
Yeah.
And so LipoLite has really revolutionized the way we do these types of procedures. And in that, now we can do it so that it's basically can be done under local anesthesia. There's really, it's so gentle the way it's done, and we'll show a video and you won't even believe it looks so easy. It looks too easy to be true. And then also it allows us the ability to create really smooth results. And then for patients like some Hollywood stars who've had bad lipo.
Okay.
And we all know, we've seen it to a point where, you're not wanting to even show your body. I mean, the whole goal of lipo is so that we can feel confident when you're out there in your swimsuit. I mean, obviously, everyone after lipo probably looks better in their clothes because you don't have some bulges, but what about if you don't have your clothes, in
So this gives a smooth result.
It gives a much smoother result.
So do you ask your doctor, LipoLite? I mean, do you have a LipoLite machine? Because you say there's others.
Right.
And you think they're inferior.
LipoLite is definitely the best right now. And
you believe that? I mean, that's a fact?
Yes, and the advantage of not coming out first as far as the laser lipolysis system, Syneron actually looked at the pitfalls of all of the other systems.
So I'm clear, the major differences then from the old technology, these old machines, and this LipoLite are what?
Well, it's the ability to control. The older technology basically just has one setting.
Okay.
But there are certain areas of the body, like say the love handles, where the fat is more dense, and there's also more fibrous bands.
So in the LipoLite, you could turn it up?
You can turn it up. You can turn it down. So if you are melting a larger, area of fat, you want more energy. So turn it up. Okay. But if you're closer up, so for the thinner, fit patients that just have a small amount of really annoying fat hanging that they really hate, and you can turn it down so then you're safe. Because that was obviously a major issue.
Is this the future, by the way, you think, of even fitness? That people will go in for these routine procedures, they don't have to really be completely out, and get lipo? with diet, exercise,
Randy, we
lifestyle.
all know that you can work out all the time, and I have many patients who come to me saying, I work out all the time, I do hundreds and hundreds of crunches, but I cannot get rid of certain areas of fat.
Okay, so after pregnancy, a woman goes in.
Perfect candidates.
Just can't get rid of that part right there.
Perfect candidates for Lipolite, because the other advantage of Lipolite over traditional liposuction is the ability to heat the skin.
Okay.
So during the procedure, that laser is not only melting the fat, but it also is heating, non-specifically heating
So what
underneath
does that
the
do?
skin.
I mean, what's the big advantage?
Contracts collagen. And after the baby, we all know, and I've had 2 kids,
all right,
the skin's not the same. How nice if we can tighten the skin at the same time as we're removing the fat.
Okay, so combination, traditional lipo, the
Lipolite.
and it smooths it out.
Smooths it out and tightens the skin.
Okay.
So these are things that as a cosmetic surgeon doing lipo, these are the things that we wish our patients can have. That if we can take a look at them during consultation and say, yes, we can remove and sculpt away your unwanted fat, give you really nice results that you can be proud to show in a swimsuit, and also give it to you while tightening your skin.
Are the patients getting in better?
It's wonderful.
Are the patients in better shape than ever before that are coming in for these procedures?
I think we have 2 kinds of patients. There are the patients who are really fit. They may have, little, fat that they can pinch, but under their clothes they look great. Or maybe if they want to fit into these really, really tight skinny pants or beautiful gowns, and they just have a little bit of pooch that, basically is the difference between looking just hot,
yeah,
or, little dumpy.
Okay.
I have those
Sure.
patients. And then I also have some patients who are a little bit larger, maybe are having a hard time.
They've tried everything.
Having a hard time, and they just need a new beginning.
So is Lipolite good for the larger patient or just the lean patient?
I would say that
Both.
you can do both. The ability to really turn it up, up the energy, and the ability to really have that control allows you to treat both kinds of
So
patients.
it's the only one on the
and
market.
also
Go ahead.
the ability to really go in combination with your traditional liposculpture technique allows you to treat the larger patient as well.
Okay, well, now let's talk about different parts of the body. Okay, you mentioned abs and flanks, the love handles. What are other popular areas?
The other big area, I think one of the more popular areas, is the neck.
The neck, okay.
The double chin.
Is that mostly men coming in for that?
Men and women. And the beauty of this procedure is that, we can hide our bodies with our clothes, but you cannot hide your face and your neck. And this is very aging, and this is also a big problem area because sometimes in the past when we would do lipo, you had to deal with extra skin and loose skin after lipo, especially after maybe 40s and 50s and older patients. But with Lipolite, it's wonderful. We just make tiny little openings that go away within a couple of weeks. There's no scar. Can you believe it? There's no scar.
Where do you go in?
I just make tiny little openings, no, we don't even have to sew it up or anything.
So
it's done under local.
So I understand this correctly, and also if somebody's just tuning in. Okay, so we're talking about Lipolite. So for the neck, you go in with this.
Right,
it's a laser.
Right, 3 little openings.
It
I go
melts the fat.
Melts the fat.
Then you go in with a second instrument, traditional lipo, tumescent lipo.
Right.
And then just suck out the fat.
Right. Suck at the fat, and then
And because
if
it's
you have to
heated,
shape.
it kind of clings to the face. Or
Absolutely.
clings to the neck.
Everything that we do in skin rejuvenation, and that I'm also, I teach doctors about this topic as well, is all about heating the skin. All of our skin tightening devices where we're applying it on top of the skin, all work through heating the collagen and tightening the skin that way. And so now we're doing it intraoperatively. During the procedure, we are introducing non-specific heating under the skin as we're melting the fat away.
How soon can somebody go back to work? They get their neck done on a Friday.
There are patients who can go to work the next day. I would say if we do it on a Friday, hang out at home over the weekend, Monday you can go back to work. It's not a big deal. And it's the same thing as well. If we're doing, small areas on the abdomen, on love handles, the knees is also, the fat around the knees, that's also a wonderful area to do Lipolite. The inner thighs, the dreaded saddlebags. Those are wonderful areas for lipolite because it allows you to give great smooth results.
So this isn't gimmicky. You don't want to hear lipolite, things like that. I mean, we're talking about technology.
Absolutely.
That just has to be the name of the technology that dissolves the fat or melts the fat.
Right.
And it doesn't come back. I mean, you're killing the fat cells?
Right.
Okay.
There's a difference between dieting and losing weight versus actually going in and melting and liquefying and removing fat. When we lose weight, we still have the same fat cells, we just shrink them. That's how we fit better in our clothes. When we do lipolite, when we're liquefying the fat, that fat's gone. So it's a permanent removal and destruction of your unwanted fat cells.
Okay, the arms. How will the arms treat?
Oh, arms are so important to us women. It really is. I mean, my patients, their lives have changed. I mean, the kind
just
of
because they're arms?
Yes, I mean
so?
kind of outfits that we pick. Just the fact that you can wear a tank top, or many women who come to me wanting their arms done, treated with lipolite. They say, I've never even worn a sleeveless dress or a tank top for years because I'm needing to cover them. So imagine the freedom to actually, being able to just get rid of that fat.
So the arms bounce back?
Absolutely. And let me tell you how it does it. It's basically with lipolite, we are heating the skin while we're removing fat. And that contracts collagen.
So that's why it's so different. Okay, so the arms are great. Now what about sculpting a tricep for an arm? Fit person.
That's what I mean about the control that surgeons can have with this technology, is that it allows you to get even, very close up to the surface of the skin because you can control the amount of energy without having to worry about, you're going to burn the skin that we used to with ultrasound technology and lipo.
Okay.
So yeah, you can definitely do that. You can sculpt away tricep. You can sculpt away the little fat that's just pooching.
Can you mold or can you chisel a six-pack to somebody that's almost there but not there?
Absolutely. We have patients who come to me and they're fitness instructors, they're bodybuilders, and I tell them, the six-pack is hidden under the fat.
Okay.
So if we just remove the fat that's just on the surface of the skin, the six-pack will show up. It will show through because now you don't have the fat covering.
So what do people say after the procedure?
Randy, it's amazing how it changes people's lives. It truly does. It's probably the most rewarding part of being a cosmetic surgeon doing this procedure, is when I see my patients afterwards and I see when it's all done, how it really boosts their confidence. I mean, when women can wear outfits that not based on trying to cover themselves, but based on showing off, showing.
Maybe did they tell you that? Now they're wearing sleeveless outfits?
Oh, they love to shop even more. I mean, I have women who come and they they go from a size 10 to now a size 4 in their pant size. And also being able to kind of go in and shop and pick out whatever. You can wear sleeveless if you've done your arms. You can show off. You don't have to worry about the pooches around the bra line. You can wear low, the pants that are low without having to worry about the muffin top roll.
I mean, do they tell you that, people? I mean,
absolutely. Life is just so much more fun.
Now you mentioned the back. I mean, around the bra straps. A great area to treat? Tough? Tricky?
It's a tough one because of the kind of fat. That's also an area where there's more dense fat.
Around the bra strap?
Around the bra strap. But women hate that. Women hate it, and it also changes their silhouette. Imagine when you have fat around there. Now you look more broad. I mean, that's, your shoulders look wider because they're farther apart. You look like a bodybuilder. And when we remove that, you now create for your patients a more feminine silhouette. And then obviously, how a huge advantage for outfits. And now women
by the way, does this heating technology, this laser, this lipolite, does it help? I mean, does it make the job of liposuction easier? I mean, the fat, now that it's melted
Yes.
comes out much easier?
Yes.
And does it allow you to get more aggressive?
As a surgeon, that's probably one of the major advantages, because you have to work really, really hard, and sometimes I'm like sweating when
Yeah.
I'm doing this, trying to get through that dense area. And sometimes if surgeons are not willing to work that hard, they just leave the fat in there, and then obviously you don't get as optimal results as a patient. So this allows to kind of, not having to work as hard.
And by the way, people need to know, the doctors, the ones that I meet off camera, they say they don't like liposuction. I probably met 4 people. And now because of this technology, now it's easier on the doctor.
And I know exactly why they say that, because traditional liposuction can be very tiring. It's very tedious. You have to be very, very meticulous. And I spend a lot more time than I think most surgeons do, but I'm very picky, and my patients get really good results because of it. And
so doctors watch this show, and what do you say to them if they're skeptical about these machines? Because I get questions, by the way, from doctors. Hey, do you know anybody using this? Tell me about the results. And I tell them about you. Well,
I don't know if I can say, but it really, if you are in the business of lipo.
For those doctors doing liposuction.
Right, for those doctors and for those who really understand how hard it is to really get great results for your patients, LipoLite is the way to go. It really is the best that we have now. It really has changed the way I do lipo in my practice. And obviously, all of us doctors want the best for our patients.
So your top pick then, Dr. Mauricio's top pick is by Syneron.
Yes,
is that right?
Yes,
okay.
LipoLite is made by Syneron, which is the biggest laser company in the world.
Oh, is it? Okay.
So they have.
But you do. You could ask the doctor. I would feel uncomfortable calling the doctor and say, by the way, do you have this Syneron machine? Can they do that?
I think they should.
Should they?
I think they should, because
Interesting.
We all know that technology improves. We know it, our cell phones, everything. And so people understand that technology gets better, and LipoLite is the best. And for many reasons that we've discussed, and both for the patients and for the doctor.
What about thighs? Those areas, knees.
It's wonderful. Thighs, I know from personal experience, it can really, affect the way you fit in clothes, your self-esteem, or your confidence when you're wearing certain types of clothing. And we all know that a lot of it is genetic. A lot of it is
basically... So does this work for thighs?
Absolutely, and that's also another area where traditional liposuction was a problem.
Why?
Because you can create a lot of irregularities, lumpy bumpies, indentation.
Because it's all the way around.
It's all the way around, and it's hard to get a smooth, kind of beautiful ice sculpture type of result.
Okay.
But with this technology, now it makes it a lot easier to really deliver results where patients will actually feel good about showing off their thighs.
So inner thighs, outer thighs?
Inner thighs,
all the way around? Do you go all the way around?
Some patients need it, some patients need it, probably not all at the same time, but if patients need it, inner and outer thighs, and even around the knees, we can do it all. Absolutely. Women hate the fat around their knees. I don't know if this is a big secret, but all women know this.
It's a big secret.
Right. Big secret for men. But, there are so many women out there who really avoid showing off their legs and their knees. They always wear pants or capris or long skirts, but never anything above the knee. So now you can hit those knees. You can hit those knees and remove that little pocket of fat, all done under local anesthetic. Very little bruising, go back to work the next day. It's easy.
And we're out of time. You brought photos.
Yes. And these are just my favorite patients to show, because it's, I think more and more men are coming in for lipo. I think they're a big segment of our lipo patient. And this is a patient of mine who came in. He's in his 50s.
He's in pretty good shape.
Yes, because he works out every day. This is a typical workout every day. But in his 50s, he still has, his pot belly, his love handles, and the chest, male chest. And he actually told me... The side view
of the chest, you can see that.
Right. And he actually told me, Dr. Mauricio, can you turn my B cup into A cup? And so we did. We did lipo, and now look at the after. This is a guy...
Looks like a model.
Well, the thing is, he's a photographer, and he photographs models all his entire career. And he said that was his life's dream. And in his 50s, he actually sent me these photos,
This guy's 50?
Randy. Yes. He's in his 50s. He sent me these photos, and he said that I made his dream come true because now he finally is a model.
Yeah.
So even in your 50s, it's not too late to, you know.
Now with his chest, I'm looking at his chest.
Yes, isn't that fantastic?
Big difference, big difference.
It's the same guy, it's the same cross tattoo.
Is it true that's a tough area, a tricky area?
It's definitely a tricky area, but it's a lot easier now with new technology, and LipoLite really makes it a lot easier for us.
Okay, good. Now who's this next person?
This is one of those types of patients who've tried everything. Tried to diet, tried to exercise, cannot lose it, but really wants a new start.
Okay.
And so what we did, I went in with a LipoLite. Again, you know, go in with tiny, tiny little cannula, melted the fat, liquefied the fat, and then I went in with my traditional liposculpture cannula, removed the fat, and this is how he looks.
Huge difference.
It's gigantic difference.
Yeah.
I mean, he came into me in the office and his pants were practically falling. And we did his abdomen and we did his love handles. And you can just imagine how much this has changed his life, how much more confident he is. I mean, he, you know, just is doing better in his job. He's doing better in his marriage.
We are out of time. But what about safety? We haven't talked about safety.
Safety, of course. Safety is always my #1 concern, and all doctors, you know, really worry about this. And it's probably the safest type of technology as far as lipo goes, because it addresses all of the things about traditional liposuction that really scared doctors and scared patients.
All right.
And that, #1, you know, with blood loss, because the laser actually coagulates the blood vessels.
Interesting.
It's, you know, it really helps minimize bleeding during the procedure, and also that's the reason why patients are bruised. There's less bruising, easier recovery.
Final message. Somebody watching this, and for whatever reason, they're putting lipo off. They want it, they're thinking about it, they can't get rid of, I guess, saddlebags or whatever.
Well, the message is, if there is a part of your body that, you know, you grabbing, you're like, I don't like it, I wish I didn't have it, I'd feel so much better without it, you know, ask your doctor about LipoLite. Really, this allows us to do this procedure in a much, much safer way than we used to in the past, and also deliver much better results that we did with traditional lipo.
Okay, we're going to put the
Syneron
website at the bottom of the screen. That's the technology you say is the hot ticket right now?
Yes, and go to their website, you know, and see how it's changed other people's lives. It's really exciting.
Well, thank you for coming on the show. Very good.
All right, Randy.
Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez. If you are a licensed healthcare provider and would like to be a guest on the Wellness Hour, please visit wellnesshour.com. We are currently looking for enthusiastic doctors who can discuss one of the following topics: bioidentical hormone replacement therapy, advances in orthopedic surgery, pain management using implantable devices, alternative medicine, new treatment options for cancer patients, the modern facelift, and what you need to know about dental implants.